You've mentioned, Mr. Gibson, the patient-centered community care program known as PC3, the Project Access Receive Closer to Home, also known as ARCH. These are what you've referred to as non-VA programs. The fact is, what we've heard, and the factual evidence confirms it, that many different VA facilities around the country have uneven, inconsistent, and different approaches in implementing these programs. There's no need for legislation to make these policies consistent. And so what I'd like you to tell us, not necessarily today, if you can today, all the better, but I think we need a study and a comprehensive approach here to making sure that the referrals are as robust as possible in meeting the needs of veterans when better care can be provided outside the VA facilities. And I'm referring to it that way because I don't view it as non-VA care when a veteran is assigned outside the VA facility. The VA is as much responsible for that care as it is when it's done in a VA hospital.
We agree, excuse me, we agree with that point precisely. It's our own unfortunate use of language, but it's the fundamental point that makes what we do different than a health plan.
Right.
We are accountable for those health outcomes for veterans.
And so I want to make this point as strongly as I can. The VA should not fear the CHOICE program or the PC3 program or the ARCH program. It's not non-VA care. It's not a threat to the VA. It's a different mode of serving the same health care needs with the best possible health care. And I think we want to know, and maybe you can answer this point as well, how long there are waits for health care outside the VA system. In other words, when there's a referral to a private doctor, is there more than a 30-day wait to see that doctor? Because the veteran, the individual veteran in need of health care, is no better off waiting 90 days to see a private doctor than 90 days to see a VA doctor at a VA hospital. And so I think we need to be as strong and aggressive in overseeing these other non-VA healthcare services as the VA direct provided services.